is Dante, and I'll be your student nurse today, and I'll be inserting a Foley catheter. Can you please verify your name and date of birth for me?
It's John Smith, January 1st, 2000.
Okay. And have you ever had a Foley catheter placed?
No.
Okay, so what we'll do is we'll insert the catheter into your urethra and then further onto your bladder to help you use the restroom.
Will it hurt?
It won't hurt, but it will feel a little uncomfortable.
Okay.
Are you allergic to any latex, iodine, or betadine?
Not latex, but I'm not sure what the other two are.
Are you allergic to shellfish?
No.
Okay. So what we'll do is we'll spread your legs, Mr. Smith. Okay. And for females, we would have them laying in the dorsal recumbent position. I'm gonna adjust the bed to a comfortable working height for me and lay you flat. Okay, Mr. Smith, I will then reveal a little bit of your genitalia. All right, and we'll begin. I will start by washing my hands and placing on some gloves. And then with a washcloth, we will clean around the genitalia. Okay. Then we'll remove the gloves. Wash your hands again. And then we'll start the procedure. We'll open the catheter bag. Okay. We'll begin by opening away, trying not to break the sterile field. Now on top we'll have sterile gloves, which we will use the bedside table to put on. Once we've placed on sterile gloving, we will then take the drape, shiny side down, and it will help extend the sterile field and get as close to the patient without touching them. Okay? And we'll have this other drape, which would lay on top of their genitalia to extend it without touching them. Okay? We will then ready our supplies for the procedure. We would first take the syringe with sterile water and attach it to the ports. And grab our lube and spread it all over the tray. And then remove the cover from the catheter. And allow that to soak in the lube. And while that's soaking, we will grab our swabs to help clean the patient's genitalia. And with your non-dominant hand, you would grab the patient's penis and start from the top tip and clean the head on down. We'll repeat this 2 more times. Females, we would use a swab to clean the labia from the furthest away, and then another swab to clean the labia that's closest to you, and the last swab we'll use to clean the labia from the top to the bottom in the center. Okay. All right, we will now begin the procedure. All right, Mr. Smith, we're about to begin. All right. For males, we would insert the catheter 5 to 7 inches or until you see urine. And for females, it would be 2 to 3 inches or until you see urine. And once you see urine, you would further insert it an inch or two for both genders. All right. And then we would use our contaminated hand to firmly secure the catheter and use our sterile hand to insert sterile water into the catheter. All right, and once the water is inserted, we'll use our contaminated hand to give the catheter a little tug to make sure the catheter is in place. Now that the catheter is placed, it is no longer a sterile procedure, so I can use my contaminated hand to detach the syringe. All right, and then we would then secure the tubing to the patient's abdomen for males. For females, we would attach the tubing to the upper thigh. Once the tubing is secured, we would attach the urine bag to the patient's bed. After attaching the urine bag to the patient's bed, I will then grab a washcloth to clean up all of the betadine off of the patient, and we'll begin from the back and down. We do not want to wipe up into the catheter. Okay. And then I will then clean up all my supplies, remove my gloves, and wash my hands. All right, Mr. Smith, we are done. And I'm just gonna cover you back up now and close your legs now. And I'm gonna lower you into the lowest position. Are you feeling any pain or discomfort?
No.
All right. And would you like to be sitting up or laying flat?
I think I'm okay flat, thank you.
All right. All right, and your call button's right there. If you need anything, just let call from me. All right. Hi, my name's Dante. I'll be your student nurse today, and I'll be collecting a urine sample. Can you please state your name and date of birth for me?
John Smith, January 1st, 2000.
Okay, as stated, we'll be collecting a urine sample from the port. I'm gonna be raising your bed to an adjustable working height.
Why can't you take the urine from my bag?
We can only take the urine from the bag right after the urine is first placed into there. Right now it is not sterile, so the only way to get a sterile specimen is from the port. Okay, so, all right, we're gonna start. I'm gonna wash my hands. Then I will come over and put on some gloves. I'm just gonna reveal you a little, Mr. Smith. Alright. And all I'm gonna do is clamp your tubing. Alright, I will then remove my gloves. Wash my hands. All right, Mr. Smith, I'll be back in 15 minutes. All right. Mr. Smith, it has been 15 minutes. All right, and we're gonna grab a urine sample. So I'm gonna wash my hands, grab some gloves. gonna review you again just a little, just for the port. And I'm gonna grab an alcohol swab. I'm gonna clean the port. And grab the syringe and attach it to the port. And then remove 10 milliliters of urine. Okay. Then we'll remove it from the port. We'll get our urine container. Insert it into the container. Then we can toss it. We would then label it with the patient's name, date of birth, my initials, the time, and the current date. After all the information is placed, I would then place it into one of the bags and send it off to the lab. And then I would grab another alcohol wipe and re-clean the ports. All right, Mr. Smith, we are done. I'll just need to unclip your tubing. All right, and I will remove my gloves, wash my hands, and we're gonna lower you into the lowest position again, Mr. Smith. Are you feeling any pain or discomfort?
No.
Okay. And would you like your be sitting up or laying flat?
I'm okay laying down, thank you.
All right, and there's your call light. Just let me know if you need anything. Hi, my name is Dante. I'll be your student nurse today, and we will be removing your Foley catheter. Can you first verify your name and date of birth for me?
It's John Smith, January 1st, 2000.
Okay. And I'm just gonna adjust your bed to an appropriate working height for me. Okay. And I'm just gonna review you a little bit, Mr. Smith, and then have you spread your legs for me. And, all right, I'm gonna wash my hands, and then I'll put on some gloves. And before we remove the catheter, I am going to drain your urine bag. Okay. Okay. And we'll first let it all drain, and then once it's all drained, we can close it back up, reattach it to the bag. We can place the urine on the bedside table. All right, Mr. Smith, we're gonna start. I'll grab the syringe and attach it to the port to remove the water. Okay. Okay. Once it's all removed, we can detach the water. All right, Mr. Smith, we're about to remove it. If you I'd like for you to take a couple deep breaths just to relax. All right, we're gonna remove it in 3. 1, 2, 3. All right, and I'm now removing my gloves, trying not to touch the catheter, and we're folding it all in. And we would dispose of the catheter and the urine bag according to facilities policy. All right. And then I would cover you up again, Mr. Smith. You can close your legs for me. And then I'll wash my hands. And then I'm gonna lower you into the lowest position. Are you feeling any pain, Mr. Smith?
No.
All right. And would you like to be sitting up or laying down?
I'm okay laying down. Thank you.
Alright. Your call light's right there. Just let me know if you need anything.
Thank you.